Dr. Huebner here, Natural Transplants. Wanted to talk to you about what to expect after the procedure and what you can do, what you can't do. So the minute that you leave the procedure, you won't be in any pain. The anesthesia tends to wear off shortly after the procedure. So for the night of the procedure, you'll have pain medications, and we use a wide variety of pain medication to treat your pain. Some people are okay even with just Tylenol and Motrin. Other people will sometimes have a little more pain, and for the first night or two we'll take something more prescribed. So we'll be happy to provide you those prescriptions, and oftentimes we'll even pick them up for you from the pharmacy so you have them in hand before you leave. But as far as what to do the night of the procedure, it's very simple: rest and ice. You're going to want to keep your head upright. You're going to want to try to limit your motion for the first night. And for the first 3 nights, you're going to want to sleep in a semi-upright, reclined position with one of those airline neck pillows to give you some neck support. Other than that, a little bit of ice on the forehead, not on the grafts themselves, but only on the forehead to decrease the chance of having any swelling. Most people are fine the first night. Again, you'll have our cell phone numbers if you have any problems. It doesn't matter if it's 3 in the morning. I'll direct you to our sales guy. No, just kidding. You can call me anytime. 3 in the morning, I'm happy to take calls. So having one patient a day allows us to do that, and I feel very comfortable handing out my number to our patients. The second day, you're going to be doing what's called a light rinse, and that involves going into the shower and taking a cup in, filling it up with some warm water, and then very gently pouring it on top of your head a couple times. And that's just to basically rinse everything off and keep everything clean. You'll notice the second day you're going to have some scabs that will be developing all through the prior night, and some of those scab tips and edges will come off naturally. It's what they're supposed to do. Other than that, again, sleeping in the semi-upright position, you're going to also be starting an antibiotic prophylactically to prevent infection. The third day is the day where we do a cleanse or a wash, and that involves going into the shower with some shampoo and a separate conditioner, and basically working up a lather on your head. So it's very simple. You're going to continue the shampoo and conditioner from then on. You want to get some soap on the back and hairline, on the suture line in the back. But as far as what you can't do, what we do recommend is not doing any heavy lifting or going to the gym until the sutures are out, which will be 10 days. Certainly people can go back to work and sit at a desk and do some simple things around the house, even do some walking. But as far as vigorous exercise and cardio, we'd want you to avoid that for 10 days. The reason for that is because all of that puts tension on the suture line in the back. That's one of the secrets to having an undetectable scar in the back, is limiting your motion, reducing the tension on the suture line so you don't have an unsightly scar. So we recommend that to all our patients. Other than that, it's a very easy process. The hardest process of the whole thing is basically waiting 3 months on average for the hair to start growing in, and then it thickens up over the next several months. So it's a little bit of a process, but I guarantee you it's worth it. All of our patients come back and said, "I'm so glad I did it. I only regret that I didn't do it sooner." Thanks so much. Check us out on naturaltransplants.com, and thank you everyone for the feedback. We've been getting a lot of positive feedback on our videos, and look forward to seeing you soon.